Sounds great.
Okay, I think we.
Okay, hello everyone. Thank you for being here today. This is our Veteran Oral Health virtual road tour stop in Alaska. Next slide. We are going to start with an introduction and a national overview of veteran oral health, and then we are going to move on to veteran oral health in Alaska. We are then going to have a discussion, and we really want to hear from you guys. A big part of what we're doing today is sharing these resources, and another big part is hearing from you. We want to know if we're missing any large pieces in your state, and we want to use this feedback for future research and learning opportunities. So please do feel free to come off camera or share in the chat or in Slido, however you feel comfortable, but we do want to hear from you today. And then we will end with some action items and next steps to veteran oral health. A few housekeeping pieces today. We are recording this session, and we will have the recording available afterwards on our website, along with the slides and other materials. And at this point, I do want to invite each of you to type your name in the chat so that we can get to know you a little bit better. And if at any point you have any questions, please feel free to write them in the chat and we will get to them as soon as possible. Yeah, so today is a little bit unique in that some of you are here remotely and some are in person in Alaska. So for those of you who are in person, I am asking you to please take a moment to scan the QR code. We are going to use this for Slido, and we're going to use Slido throughout the session today. So you can scan the QR code, or you can head to their website and type in this number code if that's easier for you. A quick tip with Slido, try not to close it out. You can keep it up throughout the session, and each poll will pop up when it's ready for you. And if you do exit out by accident, don't worry, we will have the QR posted again when there's another opportunity to use it. And for the rest of you who are participating remotely from your computer, you can just answer the poll questions on Zoom, and any questions you have, you can put in the chat as well. Next slide. These are our learning objectives here today. These were provided in the registration information and are attached to our CEUs. Our presenters do not have any disclosures to share with you today. And with us today is myself, Samantha. I am the Community Education and Outreach Coordinator with AIDPH. Our Director of Education and Leadership is Liz Flannery, and she will be presenting today. And I will give, next slide, please. I wanted to give special thanks to our hosts from the Alaska Dental Action Coalition for bringing us all together today. And I want to thank you for your dedication to veteran oral health. All right, I am about to hand it off to Liz for a presentation, but as she's getting started, we'd like to start off by hearing from you with a poll question and hear what you think are the priority areas on veteran oral health. So I am going to go ahead and load this poll question on Slido. And I will also go ahead and post this poll question on Zoom. Let's see. Okay, so here's your opportunity. We'd love to hear from you. And then I will hand it off to Liz.
Thank you, Sam. We can head to the next slide. Welcome, everyone. Thank you for being with us here today and for giving me the opportunity to speak to all of you. I'm super excited to be here with you, to be doing this a little bit more hybrid, which is an exciting format for us, and to really dig into veteran oral health. So I see the poll here. We'll give folks a little bit more time. Sam, when you see things come through on Slido, you can chime in too. Right now, what I'm seeing is access to care and integration with general health care are the biggest priority areas for folks, which is great. We're going to talk about both of those things today. So excited to dive into that. Is there anything you want to add from the Slido side, Sam?
Yeah, so on Slido, we are at 100% of access to care. So yeah, everyone seems to be in the same.
Fantastic. Okay. Before we completely dig into veteran oral health, I just want to give a quick overview of the American Institute of Dental Public Health, or AIDPH, and who we are. Our mission is to empower our community to advance oral health through science, education, and advocacy. We're doing all three of those pieces here. We're talking about ways we can advocate through an educational program based on the research products that we have put together. Our vision is a justice-oriented oral health system, and we're working towards this through the work we do with our mission. We can head to the next slide. We have 4 communities of focus at AIDPH. That includes veterans, who we're speaking about today, rural communities, LGBTQIA+ people, and people with disabilities. And we also recognize there's intersectionality between these groups, particularly with veterans and veterans with disabilities and veterans living in rural areas, which again, we'll speak a little bit more in detail to that in just a bit here. We can go to the next slide. We want to take a minute for a funder spotlight and say thank you to CareQuest Institute for Oral Health. The research that we're talking about today was done in partnership with them, and they're making this program that we're doing here today possible. And to talk about that a little bit more, we can go to the next slide. We've been working with CareQuest since 2021, collecting data, publishing data, and producing resources for organizations like yourself and folks in other states to be able to leverage the work that they're already doing into more success and to create a more evidence-based framework for the work that we're all doing collaboratively to advance veteran oral health. So we'll talk about some of the research products and pieces as we go into the data that we've done in partnership with CareQuest. We can head to the next slide. So veteran oral health, we're going to start with a national overview before we dive deeply into exactly what's happening in Alaska and the data that we've analyzed there. We can head to the next slide. And I just want to take a minute and say thank you again to Francis for the coordination that they did to get us here today. Excuse me. There were several questions sent in, which is really helpful as we were preparing. So also thank you to all of you who took time to send those questions in. We're going to try to weave those into our presentation here today, but I also want to call out what Sam said at the beginning of this call. We aim for this to be very interactive and really want to hear from you. So if we don't answer your question or another question occurs to you, please put that in the chat or chime in during the discussion time, and we want to make sure we get your questions answered. So one of the questions that was sent in was, why are so many veterans who are eligible for healthcare through the VA not eligible for dental care? Additionally, why are veterans who are eligible not receiving the care? And is this a policy issue? So we're going to dive into that. That was a great setup for how we start the call and what we look at initially. So we start with a national overview that might be review for some of you who are working in veteran oral health. But doing this work, we've really found that people really don't actually understand kind of the medical and dental benefits and how those operates. Frankly, to include veterans themselves, it can be a very confusing process to get those figured out. So that's where we like to start. An understanding of what's available, the benefits, what care you can get, how much it costs you, where you're able to receive care. That's all determined through Congress. So asking the question, is eligibility a policy issue? The answer is yes. It's ruled through Title 38, where eligibility for medical, dental, and other primary care benefits are all determined through federal code. And that can only be changed with a vote through Congress. So a law, if for example, a change was voted in, there would also need to be funding available to expand any benefits that were voted in. So changing the federal healthcare system as it relates to VA dental care would require federal legislative action. We can head to the next slide. So again, speaking to that question received and where we really like to start is looking nationally at what that eligibility is and what those numbers are. So currently, most veterans in the United States are not eligible for dental care through the VA. If you look at this graphic here, the top row of people represents all 18 million veterans in the US who are currently living in the United States. The lightest half of them are the half that receives care outside of the VA or are otherwise not eligible for care through the VA. And then as we move along to the left, the darker blue folks represent almost 10 million veterans who are getting care in the VA. And then out of that 9 to 10 million, there's just a very small part, less than 2 million are eligible for dental care. You can kind of see as those numbers get darker over there. And of that almost 2 million who are eligible for that dental care, only about a third, or 582,000, are actually receiving that dental care. And so that was a part of the question that we got, was why are folks who are eligible not receiving the care? And the answer is we don't know for sure or completely. There are definitely some factors that we understand. There's barriers to care that can include transportation, that can include availability. Again, rurality comes into this, where folks might be too far from a facility. They might be eligible, but be too far from a facility where they can get the dental care. Transportation can be a problem. Understanding the benefits. There's a lot of pieces that come into play. It really varies place to place, and takes some digging in and understanding at a local level what's happening and what's going on there from that, using the eligibility benefits. We can head to the next slide. Okay, so we want to take a minute and look at chronic disease in veterans. So veterans in particular with heart disease and diabetes experience a higher rate of dental issues. And unfortunately, what we see is that veterans with those high risk, high cost conditions are more likely to lose all of their permanent teeth, even if they're experiencing dental visits within the past year. So it's really important to look at this piece. So even among those veterans who are accessing dental care and able to visit a dentist, they're still receiving some of the worst oral health outcomes. And it's because these chronic conditions aren't managed in an integrated care environment. The VA is the largest integrated healthcare system in the nation, and they're really therefore the best position to be able to meet the chronic disease conditions and the complex medical healthcare needs of veterans. But again, looking at those numbers, most veterans are not eligible for dental care through the VA. So I know integrated care with general health care came up. Access to care really highlights that need for integrated care management, and how we might be able to achieve that if we could change maybe some of the eligibility pieces. We can head to the next slide. So we're looking at some of our most recent research that we did, again, in partnership with CareQuest, and really looking at the chronic disease conditions, because even when we control for factors like income, education, rurality, veterans with diabetes are 40% more likely to be edentulous or have lost all of their natural teeth than veterans without diabetes. We can go to the next slide and talk about heart disease. So equally concerning, if we can just skip over to the next slide, Rahela, when you have a chance. Oh, not that one. I'm sorry. Back one more. Thank you. So when we're looking at heart disease, 30% of veterans with heart disease are more likely to be completely edentulous compared to veterans without heart disease. So really highlighting that intersection of oral health outcomes with the chronic disease and chronic disease management. So then the next slide, we're going to look at that in more of a overall healthcare system perspective. We want to point out it's not just those awful oral health outcomes, but potentially the overall health impact. We understand, right, that oral health is related to systemic health. So there's those two pieces. And then it's also a very costly situation for healthcare management in general. So this, again, is pulling out some of our recent research, looking at what cost savings could be with preventative care. So if the VA would expand dental care to veterans, or if dental care can be managed in the context of an integrated healthcare environment, we're seeing that there's a demonstrated cost savings, particularly with diabetes and heart disease conditions. So some of our most recent research showed that for every dollar spent on diabetes care management, every dollar invested in preventative dental care for veterans is a dollar saved in diabetes care management. And for every dollar invested in preventative dental care for veterans is $2 saved in heart disease management. So really at that point, the preventative care is paying for itself to cover the heart disease and chronic disease management within those two diseases. So I'm just noting here, we're again looking at national information, but this is going to be relevant when we look more at Alaska and what chronic disease conditions look like there and what's happening at the local level. So just keep this cost savings and this information in mind for a little bit later in the presentation. We can head to the next slide. So where are we getting this from? I've mentioned several times our partnership with CareQuest, and I just wanted to highlight here the resources that are available on our website and through vetdentaldata.org. We can post that link in the chat. And this is just a variety of some of the research and resources that we've pulled together for organizations like yours and throughout the nation to be able to get tangible information on veterans. It can be hard to pull this data together. It can be hard to find. So we've really taken a lot of time and energy to not just collect the data with our veteran partners, but to make it publicly available and also put it in a kind of really easily digestible way. So these resources are here. We hope they're easy to access and just wanted to highlight where you can get them. And that's why we're here doing this tour, is to talk about what these resources are, where they're available, and make sure you're able to use them in the work that you're already doing. We can go to the next slide. And we're going to talk a little bit more about Alaska and why we're doing this tour. So again, the resources are available on vetdentaldata.org. We have an interactive map on there, and if you hover over the map, you can kind of see what's happening at the county level. If you go to publications and put in your state, you can pull up your profile. And there's also a data dashboard that's fairly interactive. So there's several data tools there and on top of the state profile that we're going to talk about more in depth, and just want to highlight that. Please take a look. If you have any questions or anything comes up about that, please let us know. And I also, yes.
Sorry to interrupt. There is actually a question. Francis was wondering if the coalition, if they can link these on their website.
Yes, absolutely. We would love that. Thank you.
Great. Thank you.
Great question. And thank you, Sam. I actually realized that I had my chat covered, so that was perfect. I appreciate that. We can go to the next slide and the next one. So I'm going to walk through, for the next part of this, part of the presentation, is I'm going to walk through what the Alaska State Profile looks like and what that information means. And if you're at your computer and haven't taken a look already, I invite you to go to that Vet Dental Data, go to publications and pull up the site. I think Sam also linked the direct link to the state profile. How is eligibility determined from Slido? So eligibility, and Annalise, I know you are off, but you can chime in with more specifics here. Eligibility is determined through disability. And again, it's a very complex ranking system that gets really complicated. But in kind of very general terms, you really kind of need to be 100%, have 100% disability to get a dental benefit with your VA through VA healthcare. I'll let Annalise chime in if she has any other specifics to share on that, but it gets pretty tricky and pretty complicated.
The only thing I'll add, because it is tricky and complicated, is there's priority groups. And so it factors into one priority group or two priority groups that are eligible. And the trickiness of it is probably one of the reasons why we see folks who are eligible for care not being able to access it because they don't understand their benefit structure as it relates to dental eligibility.
Thanks, Annalise. And thank you, Francis, for sharing from Slido and making sure we're getting those pieces. I love the co-facilitation. Okay, so if you're able to, I invite you to pull up your profile. Again, there's a direct link and it can be found under publications at Vet Dental Data. So a little bit about why we put these together. We've been in veteran oral health for a while, as we talked about at the top of this call. And in doing this work, we found that we were really repeatedly hearing folks asking about their state level information, what was happening in their state, what things looked like. So we really wanted to make sure that we were pulling that information together and having that information available. And then we're bringing it out because we want to see how those tools work. We want to make sure folks understand that they're available and know that they're there. And we also want to hear about what else would be helpful, how we can upgrade. Are there data gaps that you're seeing that aren't reflected here? What can we do to improve to help you in the work that you're doing with good data and good data tools? So ultimately, where we've pulled these together and we want to hear from you. We've done the best we can with the data that's available. There isn't a ton out there. It can be tricky to find, but the point was to pull it together in an analysis in one spot so it was easier for folks like you at the local level. Okay, so let's dive into it and see what we have for Alaska. We can head to the next slide. So at the very top of the state profiles is context around what's going on in your state and the national coverage, because again, just like we talked about at the top of our call, folks aren't really always aware or understanding kind of eligibility. People don't, often we find on our calls that there's at least one person, if not many, that are very surprised at the fact that folks aren't, not just everyone is available for dental care, that it's a very limited number. So we give that context at the top of these profiles. And we also went through and highlighted where veterans are positioned in the state. So if we're looking at Alaska, where are the veterans highly concentrated? You can see here, looking at the county level, we have Fairbanks census area. I'm not going to pronounce this correctly, so Francis chime in. Fairbanks, North Starborough, or Sam. Sam has a spouse who is from Alaska, so I will lean on either of you to correct my pronunciation. Man, I'm not even going to attempt this middle one here. But these are the areas that have the highest veteran population. We can also look at the map with the different numbers here and see the percentage of veterans by county. So we've included a lot of information about what we could find on rural veterans. We know that veterans are disproportionately located in rural areas, and we already know that people living in rural areas often face a disproportionate burden of disease and disability, struggle with access to care. They have unique healthcare needs just in and of themselves. So then when we have that intersection of veterans in those rural areas, it's really important to kind of understand where they're living and what that concentration is. It's important context for that state-based stakeholder to be able to make informed decisions about care delivery path and what solutions can be helpful. So that's where we started. We can go to the next section. This section pulls out some state-specific insights and looking at Alaska versus a national comparison. The national comparison was really important because if you're presenting information without context around it, it might not really resonate with folks. They're not really going to understand if that's a good or bad number. Hey, Sam, what's up? Is there a question?
I'm going to pause you real quickly. I think that we may have lost Frances and her group.
Okay.
So I just wanted to see if maybe I can contact her.
Okay.
Let me see.
And I think some folks have joined as we've been going through. So I'll just highlight, we have folks joining both virtually from their own desks, as well as a group that's all together as a group event for the coalition. And Frances was leading that on their computer. So I'll give that a second.
While we're paused, if anyone wants to ask questions via Zoom, it's a good time to hop in if anything piques your interest.
Are you shooting her an email, Sam? Okay. And I'm thinking I'll probably continue on and then we can loop back to some pieces because I want to make sure the folks who are at their computer that we're respectful of their time and we're able to kind of get through in the hour. But please jump in and let me know if you need me to pause or assist on the technical side. Does that sound okay to you, Sam? Okay, great. Thank you. Okay, so this part of the profile that we're looking at again is giving a comparison with the national level data to the state level data. And that's really important for context and understanding what the numbers actually mean in your state. It gives them the context. And again, we want these tools to be usable. So if you're presenting this information to someone who's a policymaker, maybe even another veteran or a program leader who doesn't understand the context, or if 10% is a high number or a low number, putting it in that national context really is helpful there. And our goal here was to give you national average to look at. And another option is, again, these are available for all 50 states. So you could pull up another state that might be similar, or another state that you often work with, and kind of gives context as well. So I think I primed everyone at the beginning to pay attention to the chronic disease conditions that we were looking at in depth. And because they're high cost, high risk conditions, that can be mitigated through better oral health. And because we made that connection in our research, we wanted to give state stakeholders information on how to present that information to decision makers, to stakeholders, and then hopefully make programmatic decisions to address those chronic disease conditions. So if we're looking at this part of the state profile, that's what's highlighted here. You'll find information on heart disease and diabetes, along with information like insurance status and indenturism. So again, comparing Alaska to national data, we also ranked each state across all of those diseases. And what's important to know, if you're looking at it, the low numbers are good and the high numbers are bad. So if we're looking at the numbers here, we see indenturism is 45. We're looking at heart disease at 27, diabetes 21, uninsured 31. So those are kind of middle of the road here. And again, we can kind of see Alaska compared nationally. Okay, we can head to the next slide. Okay, so when we look at the next part, we structured this as a report card, and we thought that that was a good way to pull this data together. We developed a ranking system, and we have technical information on our website of kind of how we did that if you're interested in those details. But again, in thinking about making this data usable for folks who are taking it in front of a legislator or a decision maker, everyone knows what a report card is. Most people have had experience getting a report card themselves and understanding, kind of giving that quick snapshot of where we are. So if we look at Alaska, we see there's some great places, some places that are doing really well. So if we look at indenturism, we're looking at a grade of A there. If we're looking at dental visits, we're at a grade B. So I think there's two pieces here, right? It's looking at those places where you might have an A or a B and having a conversation around, how did we get here? What was successful? What pathways did we take to get to success with this part? And then having that same conversation and looking at the places where there is room for improvement with some of those lower grades, like I'm looking at diabetes and heart disease. Are there any lessons learned from the sections where we have a high grade that we can apply to those areas that need the improvement piece? So in addition to a quick snapshot, it can really be a tool to facilitate discussion and understanding pathways of how your state got to where it is, and how it can continue on advancing better oral health. So we can go to the next slide. So we want to pause for a minute here for a chance for discussion now that we've looked at that information, and just check in and see if folks were surprised about their state profile and the grading. What are your reactions? We would love for you to put something in the chat. I think we gotten our in-person folks back?
We have not.
Okay.
I do not see them. I did post this question on Slido too. So if
Okay.
you feel more comfortable responding on Slido or chat, or if you want to come off camera and give us your thoughts, that would be great.
Okay. So please put this in the chat. Take some time to think about it. I will talk about some next steps. But plug this in, and then if someone has something they would like to share, or if Sam sees something to call out, we can have a discussion around that as well. We can head to the next slide. Okay, so how should we use these state profiles? We've talked a little bit about this with using it in front of policymakers, decision makers. So the first piece is advocating for policy, social and clinical changes that improve access. And I just want to highlight here, we have clinical changes. Something that's come up on our conversations and the other work that we've been doing around veteran oral health is when we talk about policy change, again, we started this call off with policy change. That's very big on a legislative level. It can be a bit intimidating. Hi, Francis and in-person team. We're excited to have you back. We are just discussing how we're using these state profiles. So we finished up going through some of the data exactly about Alaska, and are now kind of talking about how we can use that tool. So again, policy can be really big or it can be smaller, faster pieces. So one of the things that we've talked about is it can be as simple as changing intake forms to make sure we're asking people for veteran status. That can really affect understanding who we're caring for, understanding care delivery, making sure that trauma-informed care is considered. So when we're talking about advocacy, this education and understanding who is in the community and what the state of veteran oral health in the community is, it can be those really big steps as well as those little steps. So I encourage you to keep that in mind as you think about this tool and think through about how you could use it and the steps that you can take at your level to make change. So educating stakeholders, sharing this with policymakers, program leaders, state associations, etc. I would encourage you all to please share this with your peers and colleagues. Again, we kicked off this call talking about how, unfortunately, a lot of this information, just that basic eligibility piece, is really misunderstood or not known. We always have folks who are surprised on these calls, as well as our other work for veteran oral health. So please share this as a resource and an education piece. And the more folks who kind of know that status and know the state of affairs can get involved and work towards advancing it once they know that it's a problem. You can use this data for decision making to inform the work that you're doing, think about next steps or other programs, making a strategic direction on the work you want to do. And also reports and grants. This can be used as a funding pathway. We hope it's a tool that's easy to use to give you that data to kind of firm up the argument and have data informed grant and funding requests. So we hope that's an easy tool and an easy way to use that. We can head to the next slide. Okay, I'm going to highlight a project we did a little more in depth on veteran oral health in Iowa to talk about kind of pathways and next steps that can be taken once veteran oral health is identified as an area for action. Sam, is there anything that you wanted to highlight from Slido before I head into that?
No,
okay, I think, yeah. I know, I think we missed part of the group on that question, but we will continue with questions and discussions in just a minute here. So we want to highlight this project that we did in Iowa. And really what we did was we took a deep dive into the state, focusing on veteran oral health solutions. So it was really taking that state profile to the next level. Our research and impact team did a year-long analysis and report on the state of veteran oral health in Iowa. We did this in partnership with Delta Dental Foundation of Iowa with their support and their funding. And we were able to pull together strategic recommendations for the state. We can head to the next slide. So there were strategic recommendations based on what was happening, particularly to their state, what their veteran population was, what their infrastructure is, what their current policies are, that we were able to make so that stakeholders like yourselves in Iowa really have a pathway to taking next steps for thinking through next programs that they want to do, as well as pursuing funding that they might need to do those programs. And I highlight that because Iowa as a state determined that this was a focus area for them. And this was a research product we were able to produce to help them with those next steps. And so if that's something you're interested in, please let us know. It's also, something that we hear on these virtual road tours is folks always want to know what other states are doing. That's something that we really hope to carry through is success stories from other states. Iowa has had a lot of success around their Veteran Trust Fund. They've been able to fund a lot of oral health care solutions for veterans through that. So if that report is of interest and folks want to know what's happening in Iowa, that would be great. Yes, Francis, thank you. And we'll have here too about hearing success stories from Alaska, but that's a piece of what we're doing here is really trying to gather those success stories from states. We're putting it together in a report in 2025 to share out amongst all the states what each other are doing so we can kind of build off of those local successes. So we can go to the next slide. And we're getting ready for our discussion session. So I'm going to hand it over to Sam to kick that off.
Great. Thank you, Liz. Welcome back, everybody. So you just heard some strategic recommendations from the Iowa report. And I just want to start off our discussion by asking what next steps seem viable for you or your organization in taking to advance veteran oral health? And please feel free to answer in the chat or Slido, or if you wouldn't mind coming off camera, if you have thoughts, we'd love to hear from you.
All right, I took us off in the room off of mute briefly, so I wanted to make sure I could see everyone, so I'm not talking over anyone. I'm thinking in terms of the coalition, health literacy and talking about eligibility and who veterans can speak to would probably be a good start. That surprised me a lot that it's so challenging even to know if they're eligible or not. And I'd be really interested to know if other state, either the oral health programs or their coalitions are doing something similar. I realized I lost the questions too because I expanded my view.
No, that's okay. We're
okay.
We were, and I should also say, I will let Sam chime in here, but we're happy to kind of go if another question occurs or another, we're always happy to go in another direction or expound off of the discussion questions we've posed. I think that's something that's interesting, Francis, is so, when we're looking at the eligibility criteria, there isn't publicly available eligibility information by state for VA coverage. Since it's related to disability status, there's no way to get that information. It's not publicly released. But I think there's always opportunities working with the bases in the area and kind of the different offices that they have and the processes that folks are going through when they're coming out of service and retiring. That's definitely a pathway to see if there's opportunity for partnership and education programming there for sure. The VA might be another pathway for that as well, but I know that there's a lot of offices and nonprofit organizations too that work on kind of that kind of off-ramping, becoming a civilian process. It can be very long and there's a lot of information. So I think there'd definitely be some pathways there.
That's great. Does anybody else have any thoughts?
Yeah, I'm so sorry.
Because our organization is one of the community referral providers, but it's extraordinarily difficult to be one of those because every treatment plan that you make, even the exam itself to make the treatment plan has to be approved ahead of time. So it's not like because we work in long-term care facilities, can very easily see the veterans that same day, but we actually cannot because it has to be pre-approved. And even in Shelley, who's on, could probably correct me if I'm wrong, but the reimbursement is actually lower than Medicaid reimbursement is. Wow. Yeah. So it's not, it de-incentivizes, if that's a word, it de-incentivizes people to become community care referrals. Because there's an administrative burden and then there's a lack of reimbursement for those services. So if there is a way to work around that, or if Iowa or somebody has found a way to streamline that, or find outside funding that makes providers able to see veterans, because otherwise you're basically doing the work for free.
And also the time frame for that.
Oh, yeah.
To get that approval is what, 6 to 8 weeks?
Yeah,
I mean, that's ridiculous.
yeah.
Wow, yeah. So that is definitely a barrier. The Iowa, Liz, you know more about this than I do, but the Iowa Veteran Trust Fund, maybe you can speak a little bit on that. I know you mentioned it earlier, Liz, but that might be a piece of information that they're looking for that we have found has worked pretty well for Iowa.
Yeah, Annalise, did you want to talk about the Iowa Trust Fund a little bit? I was also going to suggest some local legislative education. I see opportunities for that around that as we continue to hear that administrative burden piece, but I'll let you chime in.
Sure, happy to do that. So Iowa has a really cool and what we've discovered is somewhat unique program called the Veterans Trust Fund. And this is essentially like a block grant that is authorized, not through Medicaid, but it is authorized through their state legislature. And it allows for a certain amount to go directly to a veteran to pay for out-of-pocket costs of care. And it also covers some other things too. Like I think there's some wording in there around education and housing and basically covering the needs of veterans. And there's a cap to it too. So there's an annual cap about how much a veteran can get for those out-of-pocket expenses. And what's really cool about that program is that they pair it with an iSmile coordinator program that actually navigates those veterans into care and helps them with the paperwork to apply for those funds. So we like to prop Iowa up as kind of like a best practice program where some states who may be shy to expand Medicaid, and maybe that's not the right choice for them, there's another kind of legislative option that can help fund that kind of work. And the other comment I just wanted to add was that there has been a recognition, at least on the federal level, that the administrative burden of approving those treatment plans through the community care network is cumbersome and ultimately inhibits getting veterans into the care that they are eligible for. And there has been some legislation that we've seen offered this Congress actually that would put more people into that approval spot so that the approvals happen faster. I haven't seen any legislation that that doesn't require approval. That's not opting to get that pre-authorization. But I think I just wanted to note that at least Congress is paying attention to that administrative burden and recognizing that it is unnecessarily inhibiting access to care. So wanted to throw in those two responses. And Liz, I know you had another comment you wanted to make too.
I was just, I always think to that education piece, and I said this several times, events like this, educating the folks, the stakeholders doing the work. And then also there's an opportunity for you to work with your local legislators. It might be federal policy that needs to change, but starting that education level at the local level, if you are working with your local reps that are then going to DC, they're understanding that what's happening in their state. It might give them insight into an issue that they might not have looked into before or might not understand that they need to look into, and then they can make a further argument. It's a small step, but it's an important piece. So just lighting a little fire to continue down that education path. I want to make sure we hear everyone's voices, but Francis did send in some questions. And so when we're talking about kind of next step pathways that people can take, someone had sent in a question asking about, of the Alaska veterans who visited the dental office, do we know what offices were visited? Tribal health, private practice, community health. And the answer to that question is we don't have a clear sense of where they're accessing care. for each state. There's no surveillance system that collects that information. It's definitely a data gap. So I'm sharing the question and the answer that we don't know, but it's definitely an action step that the state could pursue as the next step if that's helpful data to have. So I wanted to highlight that question that came in.
Thank you, Liz. It looks like we have a question from the chat. What turnaround time are other providers experiencing when submitting VA pre-authorizations? Can anyone comment on that?
Almost, yeah.
Yeah, I was just thinking the
Yeah.
same thing, like we might have all the providers in
Yeah.
the room with us, actually.
And that's actually probably Shelley asking that question, so, yeah. Shelley, do you want to write in there what our turnaround time has been, just so people know?
And just to follow up too on the question that
8 weeks, yeah.
the question that about the different types of dental homes, that is something that like I would find interesting at the state oral health program level, but it does kind of seem, it sounds as though that would be a step that would maybe a couple of states would need to be asking for, or we would need to strategize and make it a worthwhile initiative, because that I know from experience that looking at any sort of intake, outtake, or insurance data, that is a big ask.
I'll follow up, Francis. Another question that you sent in from your group was asking about Medicaid and how many veterans in Alaska either have Medicaid or eligible. And we unfortunately have a similar answer, and that we don't know because Medicaid varies state by state. And as a very small nonprofit at the national level, we don't have the capacity to access that for all 50 states. But again, it's another great follow-up for the state to look. So if you're talking about surveillance systems and looking at that dental home data, that might be a piece that's important to work in there as well.
And just as a follow-up to that too, I'm thinking about the challenges with eligibility. I am just going to guess that veterans who are eligible for Medicaid, that's probably also a really variable category and difficult to assess. I think in terms of looking at the data, that would be helpful because we could probably just see whether or not they have it. But in terms of knowing whether or not they might be eligible, that seems like it might be a really complex question.
Yeah, and Francis, Annalise had a comment in the chat as well that you could consider a needs assessment where you send out a survey to get self-reported data where veterans are accessing dental care outside of the VA. So it's a great call out, Annalise. And then there is another question. What is the best way to determine eligibility? It's a great question. Does anybody have thoughts on that? Or any best practices they're using?
Could I ask a clarifying question, Shelia? By determining eligibility, do you mean determining the number of folks in Alaska or understanding the mechanism of determining eligibility?
And I know Shelley doesn't have audio, so I'm just gonna note that. So she's probably typing right now. I have another question, but I'll wait because I don't want to overlap.
And Liz, it looks like she was looking for the mechanism.
So I'll share that it's actually really hard to determine eligibility, but the VA knows. They know which veterans are eligible for care. And I think if a veteran kind of came into my office and didn't know if they were eligible for care, that they could look that up. The process for getting a disability rating related to dental care, like Liz talked about. So maybe you already have a rating and it enables you to go get medical care in the VA. It's not common by the VA's own data to receive a rating that's specific to your dental needs, like to your mouth, unless it's related to trauma. So perhaps you're a combat veteran and there was some sort of trauma that occurred, and that is probably the most common way to get a rating specific to dental care. Otherwise, it's really that you have total disability or 100% disability rating that would lead you to have eligibility for dental care as a byproduct of that overarching eligibility status. So I hope that well, I'm saying I hope that makes sense, but it probably doesn't. And actually, AIDPH and CareQuest a few years ago, we did a national survey in partnership with our veteran service organizations and like the VFW and Disabled American Veterans. And we asked them, do you know if you're eligible for medical care through the VA? And something like 90-something% of veterans knew whether or not they were eligible for medical care. So very few answered, I don't know. And then when we asked them, are you eligible for dental care through the VA? 43% said they had no idea if they were eligible for that care. So we know that understanding benefits is actually one of those critical issues, and that there are not enough dental clinics for folks who are eligible to get into that care, and that might also be prohibitive.
Thank you, Annalise. That was really helpful. So we are touring different states and looking for information. And I just want to ask if you have had any success stories with veteran oral health policy or programming or advocacy, anything that you could share that has been working that we could share with other states as well. So I'll pause and see if anybody has anything to say about that.
I've unmuted our room here too, because I know we have providers here, but that's a good question. I'm suspecting like that's why I'm here with this presentation, is that I don't have any for my program specifically, but I would definitely like to.
And that's an alternative too. If you have a current goal that you're working on, if you're working towards a success story or where you want to get, please share that as well.
Oh, I'll raise my hand for that one because I have a new one as of just this meeting. I was writing down some notes about the cost benefit analysis and looking at chronic conditions and dental care. And I don't know if this is necessarily in the cards for my program, the oral health program at the state, but if a funding opportunity comes through for us, we would have a chance to take a look at the impact of diabetes and dental care and start drafting some recommendations for the state based off of that. And I didn't really focus on veterans as a population of focus for that particular work, but I made a note for myself to do that. And I know Jennifer, that's on the call here too, was talking with me recently about this. So that I added that as something that would be really helpful to do. We don't have a lot of data about that at the state level. And if that's helpful for providers too, let me know what would be the most helpful for you to hear. What would be the most helpful in advocating for policy to make those changes you need for access to care?
Yeah, Francis, I think that's a good idea. And if we had the statistics, then, you have something to go with rather than saying they need this, but if we had because of percentage.
I also really like doing a cost benefit analysis. That doesn't come to my mind in public health a lot. But we know that when we're advocating for policy, that is really important to a lot of people.
Money talks.
Yep. So I wrote it down with dollar signs and I will keep that in my back pocket. That would be an excellent and achievable work for us, I think.
And I think we can say we've had success stories in the patients that we have seen who we've treated, who are veterans, but our problem is the administrative part of it, so which personal success stories, yes, but administrative success, no.
And even just the reimbursement, it's not. So yeah, our organization's success with it, we don't have a success other than being able to treat the patients, but it's a struggle. I would say it's actually more of a barrier trying to go through the VA.
Great.
Yeah, so I did want to just mention that, so there is in Matsu Valley, which is, it's the Susitna Borough, which is north of Anchorage where we are. They have a program called Links, which has a sub-program called Veteran Directed Care. And so they actually somehow receive funding from the VA or grants, and they are able to provide home services for veterans who need long-term care, or like, nursing level care, but they want to remain at home. So they actually provide like nursing level care at their own home. And so I was just curious if any of the other states, if you've heard of something similar to this program, or if they've been able, because we can actually do home visits. We do that for people who are residencing in these facilities. We go right into their rooms and provide the dental care. And so I was curious to know, is there any programs that you guys have heard of where dental people can be involved in something like that, where they can go to the veterans' homes and provide the care, especially for those who would be 100% disabled and, may not have transportation, the ability to be mobile to go to a dental clinic?
I don't think I've heard, Annalise, I can see your thinking. I have not heard of another state doing a similar program. So that's really interesting. Thank you for sharing that. That's definitely food for thought. Especially as we, as we said, we do a lot of rural work as well, and working with folks who are doing that rural work. So it's definitely something we'll keep our eyes and ears open for. I know we're headed towards the end, and I just wanted to highlight real quick, Francis, circling back to what you were talking about with your diabetes work. I just wanted to highlight that Jennifer Lockhart put in the chat here earlier that she's a state diabetes prevention and control manager and welcomes the opportunity to collaborate to improve oral health for veterans. So hopefully that's a connection we can make. Francis, I'm assuming y'all can't see the chat as easily as we can. So if that sounds like a pathway that you're going to go down, I think we can connect y'all through this call.
Yeah, I did. We have dual screens here, so I did get to pull the chat up in one whole screen. That typically wouldn't be something we could do, but yes. And I know that Jennifer's also aware that the funding that I'm hoping for potentially might be able to apply to this work is in limbo. So we'll have to see how it goes. But I do think that that's a great, that data would be a great step forward. And I'm not sure too, if that's something that other states might have, if they've also kind of looked out for the same funding opportunity. That might be something that could get more national attention. Yeah, I know we're nearly at the end, so I will sit back. I have a quick question, but I think that there might be another discussion question or anything else from other groups. So I'll sit back for a second on that, because I do know we're like a minute away, even though we started late. We started a little bit. And then some of us disappeared for like 10 minutes. So.
No, thank you for your participation, Francis, and the whole group. We really appreciate it. It sounds like there's already a good connection made, which is wonderful. But we do want to ask what other resources would help you in working with veteran oral health. I did launch the poll on Slido, and I will launch the poll here on Zoom as well. But if there is something that we did not include, please also call that out. So let me go ahead and launch that now. Yeah, so any other thoughts too, please share in the chat, or you can come off mute. So both polls are launched. Looks like in Slido, 50-50 educational materials and 50% policy briefs. From our poll on Zoom, so far we're at policy briefs and training modules. So I'll give it another few seconds to see if anybody else has any input, and then we'll close those polls. And like I said, if there's anything that we've been missing, please put it in the chat. Great. Thank you. And here's our results. Yeah, it looks like policy briefs and training modules, as well as educational materials, were the top answers. So I will hand it back over to Liz now.
Sam. Rahel, do you mind just bringing up our last few slides? And thank you also, Rahel, you were faster than me on grabbing that Iowa Veteran Oral Health Report. So we linked that in the chat and are happy to email that out as well as answer any questions. We can head to the next slide. So our next steps, CEUs are available for this session here today. You had to have attended the full session for those CEUs. We can put the link in the chat. It will pop up at the end here as well. Francis, I know you all popped off for a few minutes. Y'all can still send in that CEU piece. We can give you the recording too if you want to find those few last minutes. So no worries there on that piece. To that end, the recordings and resources from today's session will be available in a little bit on our website. The resources that we talked about can be found on vetdentaldata.org. We can head to the next slide. And again, I just want to say a very big thank you. Thank you for your time and energy today, for engaging in discussion, for listening to the information we had to share, to Francis and team for coordinating and getting us all together. We believe that veterans deserve equitable oral health, and we're thrilled to have you as partners in that. Please follow up with questions. We'll follow up with resources, and we'll talk to everyone soon. So take a look for that CEU link, if we can grab that, Sam or Rahel, and pop it in. We'll email it out in the next day or so as well. And we'll talk to everyone soon. Have a great day, everyone. Thank you.